Hello, my name's Eden Endress. This is my abdominal assessment video. This is the video of the room. There's TVs, but they are off. No computers, anything like that. Hello, my name's Eden Endress. I'll be your student nurse practitioner today. We're going to be doing an abdominal examination today. Any questions before we get started? All right, I'm just going to have you lay down and get yourself comfortable. And then I'll have you pull your shirt up. I just need to see about there and below. So first I'm going to assess the abdomen, and I'm going to kind of look at it from the side. I'm looking at contour. I'm looking for any pulsations. I'm not seeing any abnormal, like visible peristalsis. I don't see any aortic pulsations. I'm looking for symmetry, which it looks equal on both sides. It's flat, not rounded. I don't see any scars. The distribution of hair is normal. It's pink in color. Yeah, no discolorations. And then next, I'm going to listen to bowel sounds using the diaphragm of my stethoscope in all 4 quadrants. And I am hearing present bowel sounds. Let's see. Next, I'm going to listen for friction rubs over the liver and the spleen. So for the liver, I'm going to listen right here. For the spleen, I'm going to move over here and listen. And I'm not hearing any friction rubs. And then I'm going to listen for aortic, iliac, renal, and then femoral artery bruits. So for the aorta, I'm going to listen halfway between the xiphoid process and the umbilicus. I'm going to move about 1 centimeter to the side and a little posteriorly and listen for the renal artery. And then I'm going to do the same on the other side. For the iliac arteries, I'm going to find the umbilicus and listen just laterally, maybe a little bit lower. And I'm listening for any bruits, abnormal sounds. And I'm not hearing any. And then I'm going to listen for venous hums using the bell of the stethoscope over the epigastric area. In the umbilicus. And I'm not hearing any venous hums. Then I'm going to move on to percussion. And I'm listening. I'm just hearing like tympany. Really didn't hear any dullness except for a little bit in that epigastric area. I did hear some dullness. And then I'm going to percuss for the liver. So I'm going to start at the midclavicular line right below the nipple and listen for the change. So I think right here marks where my change was on the top. I'm gonna start about a little higher than the umbilicus midclavicular line. And then I'm gonna say about here, and then I'm gonna measure that. And it's at 3.5 inches. I need to convert that to centimeters. I didn't realize this was only inches. But normal vertical measurement of the liver is 6 to 12 centimeters. And then I'm going to do the same palpate for the spleen. So I'm going to use the anterior axillary line, and I'm going to percuss. And then I'm going to have you take a deep breath. Okay, so it was tympanic in sound on both times. When he took a deep breath, it would push the spleen closer to me, and if it was enlarged, I would hear dullness instead of tympany when he's inhaling. And then I'm gonna move on to palpation. So I'm just gonna use one hand and lightly palpate all 4 quadrants. And I'm just going about 1 centimeter down. This is like superficial palpation. I'm feeling for any masses, lesions. And then I'm going to use 2 hands and push a little bit deeper. And I'm feeling for any masses, lesions. Okay. I'm going to have you breathe through your mouth. Thank you. I'm just getting a little bit of good. Okay, so I didn't feel any masses. Everything's nice and soft. And then I'm going to try palpate the liver edge by using the hooking technique. So I'm going to use 2 hands and find the rib cage and put my hands underneath it. And then I'm going to have you take a deep breath. Breathe out. One more time. Okay, and I cannot palpate, feel the liver. And then next I'm going to palpate the spleen. So I'm going to use my left hand and place it kind of behind the patient here, and then use my right hand and kind of get down there. And I'm going to take a deep breath. And exhale. And if the liver was enlarged, I'd be able to feel it when he exhaled, but I cannot feel it on that side either. And then I'm gonna skip the CVA tenderness for now and the palpation of the kidneys until the end of the video and move on to assessing for ascites. So if my patient did have ascites, I would probably see a change in the contour of the abdomen, and then I would use percussion and mark angles of dullness as I move down the abdomen. But it is tympanic throughout. And then for the appendicitis, the classic is to palpate the right lower quadrant, which is the, can't see it. Okay, I'm sorry, I'm having a moment here. Rovzig sign, right-sided pain during left-sided pressure. So this is the rebound tenderness. So I'm going to press down on your left side. I want you to tell me if it hurts worse when I press down or when I let go and where it hurts. Any pain? Great. And then the next one, I'm gonna put my hand on top of your right of your knee and try to lift your leg up just on this side. Any pain?
No.
Next, I'm gonna check. You can relax. I'm gonna lift this leg up here, and then I'm gonna rotate it internally. Any pain? Very good. And then the next one is just testing, finding the angle, and I can't say, I think it's TRB, and I'm just going to press down in. Is there any pain with that? Okay, and that would be a classic sign of appendicitis, is if the patient had pain with the palpation on the right lower quadrant. And then the next one is cholecystitis. I'm going to assess Murphy's sign. So I'm going to just have you relax a little bit, and I'm going to feel for your liver edge here. And then just take a deep breath. Exhale. Any pain with that? Okay, great. And then for this last part, I'm just going to have you sit at the edge of the bed here. I'll have you sit up. And I'm gonna have you scoot down just a little bit so you can see over here. And this is the CVA tenderness, so costovertebral angle. So I'm gonna find the bottom of the rib cage and follow it up. So this is about where the CVA is, and I'm gonna assess for like pyelonephritis by just a brisk. Any pain? I'm gonna switch to the other side here. Any pain? Great. Okay, and that is it. Thank you.